Department of Community Health. Good morning, and thank you very much for being a part of today's release of Michigan's first Autism State Plan. I'd also like to thank Senator Marlowe from the Health Policy Committee for joining us today and for all of his support. My name is Lisa Gross. I am the Autism Administrator at the Michigan Department of Community Health. I am honored to be working on this important issue and to be working with the outstanding members of the Autism Council, led by Dr. Colleen Allen, to provide a solid foundation and resources for families in Michigan. The department and all the families living with autism, including myself, would like to share a sincere appreciation to all of you who helped and supported the development of this plan. The continued inspiration from the governor's office has really made us very proud because it took much innovation and collaboration to make this occur. It will take hard work now and synergy to implement these recommendations that will support the individuals and their families with autism, as well as the professionals providing individualized quality services. It is the goal of the plan to improve the quality of lives for people living with autism. We are looking forward to working in an efficient, collaborative, and diverse group to make this happen. I would like to thank Dr. Amy Matthews for her endless devotion and leadership to the START project, to the Autism State Plan, as well as the Autism Council. It is my pleasure to turn it over to Dr. Amy Matthews.
Thank you. I'm really glad to be here and introduce the state plan to everyone. I want to say thank you to the Department of Community Health for facilitating this release of the Michigan ASD State Plan. And thank you to the Lieutenant Governor for really supporting this plan and ensuring that the recommendations have a chance to become reality. A few years ago, a group of dedicated people envisioned a state strategic plan for individuals with autism spectrum disorder that would really define the future of both public and private services and resources for individuals with ASD and their families in the state of Michigan. And today I'm very pleased to have this opportunity to share the Michigan ASD State Plan with you and the people all over Michigan. The plan would not have been possible without the diligent and dedicated work of the 9 development committee members who worked very hard to make sure that this plan was high quality and effective for the folks in the state, including my co-chair, Jamie Owen DeSchreiber. I also want to thank the 40 members of our advisory committee who reviewed the plan and gave multiple perspectives to the plan. And I also want to say thank you to Mitchell, who is literally the face of the Autism Spectrum Disorder State Plan. The number of children diagnosed with autism is continuing to rise dramatically, and it is essential that these children have the best education, healthcare, and interventions possible. We also have adolescents in the state who are preparing to transition to adulthood and need access to employment, college, social connections, and multiple living options. We have adults on the spectrum in the state who need to have the same rights and privileges afforded to all Michigan citizens. The hopes and dreams of individuals with autism and their families are not much different from that of anyone else. We need effective systems and supports to ensure opportunities are available to realize these dreams, and that's why we've created this plan. When you read the state plan, I hope that you find that the vision is evident and there are 3 core concepts that should come out in the plan. Opportunities and access. All individuals with autism spectrum disorder should have opportunities and access that leads to full community integration and participation. Second, system and service coordination, which is essential to offer high quality services and care. And third, information, resources, and training that are accessible and individualized. So I look forward to working with colleagues and families to move from designing a state plan to implementing a state plan. So thank you very much, and I turn it over to Dr. Colleen Allen, who is the chair of the Governor's Autism Council.
Thank you, Amy. And again, just to recognize Amy and her development committee, which they all gave hours and years of volunteer service to see this plan become a reality. So the release of the plan today, of course, it's the beginning of our hard work in this state. There is a lot to do based on what we just heard. And so I think the next logical question is, where do we begin, right? And if you're a family who's been struggling with this disorder for years, that answer is probably very clear to you, whether it's to secure clinical therapies or educational services, or even where is my child going to live once I'm gone. Those are really important issues. And so how do we begin to decide where to start? And the answer to that is the council. So I'm going to talk just a little bit in my few minutes about who those people are. I first want to thank our governor and the lieutenant governor for giving us the opportunity to check off the first priority in the plan, which was to create a state autism council. That happened through executive order back in July of last year, and it represents individuals impacted by autism, systems of care, and is represented by 4 state departments, so Department of Education, Department of Community Health, Department of Human Services, and Licensing and Regulatory Affairs. Additionally, it is represented by a clinical provider, a representative for educational initiatives, a university, representative, nonprofit, a parent, a person on the spectrum, and I believe a community mental health provider. So as you can see, it's a group that could potentially oversee these many, many recommendations and assure us that this work is going to get done. But even given the qualifications of this group, and believe me, they are a highly qualified, phenomenal group, and I'm proud to be sitting on the chair with them, or sitting on the council with them. Just, I guess, to recognize that 12 people are not going to do this. We are going to be looking for very committed individuals to work in the subcommittees, and that's really where this work is going to get done. So please, I believe our website is live today, and you can go to the website if you have an interest in helping. And finally, I just want to make the point that the plan is for everyone. The plan is not just for the people in the room. It is not just for the council. It is not for any individual department of the state. We all have to work together in a coordinated effort to make it happen, because it will not otherwise. So thank you, and we appreciate your interest in being here. And next up is Director Haveman from DCH.
Thank you, Colleen. It's great to see everybody here today. You know, whenever you start along a path, you need a map, and this is just great for the department. And I appreciate all the hard work and everything that went into it. It's a significant day for the department because, you know, in this everybody knows in this room how difficult it is to get legislation passed. I mean, you need interest groups, you need champions like Lieutenant Governor, you need champions like Senator Marlowe. You need senators and people in the House. You need interest groups. You need parents, and you need kids, and you need everybody kind of working. And sometime it all kind of comes together. And this was a tough bill to get passed, but and one of the great features of it is Lieutenant Governor Brian Calley not only championed this bill, but he also happened to be able to sign the bill, which was a real privilege if you can sign a bill, and we want to thank you for that. Since the department has hired Linda Gross to be our coordinator of this program, we're hiring 2 additional staff to do training and to do collaboration and to assist in the implementation of the report. You know, we have about 16,000 children in our state with autism. The community mental health boards have seen about 3,000 of these over the past couple of years, but with very limited services like speech therapy and a few other things. But now we're talking about the whole movement towards applied behavioral therapy, the ABA, and I must say the universities have really stepped up to centers of excellence, and I just want people to know who are in other states who are interested in coming back to Michigan to work as therapists with autistic kids and with their families. The door's open. Come on back. There's going to be opportunities for you. In fact, the waiver that we applied for with Medicaid after the bill was paid to be able to cover this was the first Medicaid waiver applied for in the country. So it's another first for Michigan. We're very proud of that as well. We want to thank the partners and the other state agencies. A lot of people have been part of this. Your insight has been key to making this happen. I also want to thank the families who are here today, and I'd like to invite one of those families up to the podium right now, our Lieutenant Governor of this state, Lieutenant Governor Brian Kelly.
Well, thank you everybody for being here and being a part of this unveiling and this announcement. I thought I'd give a little bit of a perspective, first of all, where we came from. This is a process development of the state plan which actually predates the Snyder administration. The work of this started many years ago, and Amy Matthews and Colleen Allen and many others in this room were a part of that as it worked its way through a very exhaustive process of identifying where gaps are and what needs to happen for the future. And so I want to say thank you for all those who diligently worked, and now that we have a framework with the Autism Council that includes, by the way, major stakeholders and the state departments that are impacted and that need to work together to bring these recommendations to fruition, we have a really great shot at success. And so one thing that I wanted to try and articulate maybe is when you go through and you look at the recommendations in the plan, then in a lot of cases we're talking about something that's different than just identifying a service that is needed but not yet there. In some cases it's more about what services that are there and how well do they work for people and families with autism. And so, for example, with our education services, we have education services in Michigan. We have significant education services in Michigan, from early childhood on to postgraduate education. But how well do they work for people with autism? We have law enforcement services that keep our streets, our people, our property safe. How well do they work and integrate in with the needs of people with autism? And I think about, just to illustrate this, I think about a time when I was 20, I was playing touch football in the snow at my in-laws' house. And they get kind of rough over there. You know, they say touch football. And I ended up injuring my knee, and I had to have surgery. And my knee was in an immobilization brace for 7 weeks. And so, in other words, I couldn't bend my knee for 7 weeks. Here's what I found out over the course of that 7 weeks. The entire world is designed around an assumption that legs bend. Right? Everything assumes that legs bend. Nothing works well for people whose legs don't bend. Try and get in your car without bending your leg one time. Try and put on your pants or tie your shoes with a leg that doesn't bend. That's how I think about the work of a lot of the work that needs to be done by the council in the implementation of these recommendations, is that you have a whole world that has all kinds of opportunities and services available, but how well are they designed around, or how well do they accommodate people with autism spectrum disorders? This is really hard work that'll take a tremendous amount of collaboration and busting down of the barriers and the silos that traditionally exist in so many of our services. So we know that there's a couple of big steps that have already happened. But what this is about saying that these are the beginning steps, not the end steps. And so when we passed the autism insurance reform, this made the economics around providing behavioral therapy services and other important services possible. So that was one of those baseline things. If you don't have that, there's a whole bunch of other things that will never work well. And then the council itself, to bring all the interested parties, the relevant parties, the parties that have a major part in making the world work better for a person with an autism spectrum disorder, that's a critical next step. And so where we go from here, it's going to be a long-term plan. It's going to take a tremendous amount of both discipline and perseverance to do things in new ways, to think about things in different ways that work better for all of our people. And we think about our kids, it's really easy to advocate for our kids. We have 50,000 adults, estimated 50,000 adults with autism in Michigan today. And so independence and employment services and housing, these are huge, huge obstacles. But I'm reminded of or huge jobs, I should say, and the obstacles are great, but I'm reminded of a story. In fact, this Homes for Autism over in Oakland County is starting this process now where they're expanding a little bit, and you think about how do you solve the problem of housing for that many people? Where do you even start? The answer is every community needs to start, just needs to take a step. And so I'm reminded, though, of the story of boys walking on the beach and the tide's out and he's throwing these starfish out in the water. And a man comes up next to him and says, "What are you doing? You got thousands of starfish out here on the beach and you're throwing in one at a time. You're never going to make a difference." The boy picks up a starfish, throws it in the water and says, "Well, I made a difference for that one." And so I think that's the attitude that we need to take. That this is a big, big job in front of us. And so why don't we just make progress, commit ourselves to making progress every single day, even if it's a small step. Even in cases, we'll celebrate when we can take the big steps. And then before we know it, a year from now, 2 years from now, 10 years from now, that Michigan will be the place to be if you are a family that is living with an autism spectrum disorder. So for everybody who's had a part in the development of this plan, and for all of those who will have a part in the implementation of the plan, I want to thank you for your commitment, for your dedication, for your hard work and perseverance over the course of years to make to get us here to this to the box where we're about to really start running. That's the end of my comments, and I'd like to invite the other speakers up to stand with me as we take a few questions, if there are any.
From the media, like I said, our speakers are kind of on a tight schedule today, so now is the time to ask.
Lieutenant Governor, you talked a little bit about the fund that was passed last year, and we've seen the underutilization of that. Can you just speak to why it's so important?
Sure. The question was regarding the, we did pass an autism insurance reimbursement fund, which was meant to be an incentive for the insurance plans, the self-insurance plans that are not subject to state law, an incentive for them to go ahead and self-adopt. In other words, take the cost aspect out of the equation to make sure that all of our kids have an opportunity to access this service. With respect to the utilization of the fund, I think there are a couple of things that have happened. First is that some insurance companies have simply decided that this is a normal medical service that they're going to provide in the normal sense, and so they're choosing not to participate in the plan and just making it part of their normal insurance coverage. But I think a bigger part of the issue there is the fact that we started with virtually no behavioral therapists in Michigan, just really a few dozen. And when you consider the type of numbers that we're talking about, the 15 or 16,000 kids that we know about, and then all of the adults beyond that, to say that we only had at that time 30-some behavioral therapists, there just wasn't anybody to get the services from. Now, my hat's off to the universities, particularly Western and Eastern, and then Oakland, along with Michigan State and U of M, that have all really stepped up to create a stronger pipeline of professionals that can provide these types of services. This won't happen overnight, but I think we're probably up to, Colleen, are we up to maybe 45 or so now?
Actually the past month I think we added another 5. We're almost close to 50. Which doesn't sound like a lot, but it really is a big jump when we were at 40 less than a year ago.
And so as we make these steps toward creating a network of providers, I think we'll naturally see the insurance claim activity increase with the providers. Yes, sir?
Bob Van Rochen, but I'm wondering, why not have somebody who's, now I got an idea, why don't you scan through your college graduates and have somebody who actually have the disability in your little so-called plan? Because I'm sorry to disappoint, but what good is it going to be if you don't have the experience? The people who live it can help you. Want to have some minds, people, why not take them into your plan? People who actually have a disability, who are on a college level. Put them in your board. That's what I always say. They can give you the first aid experience you need.
Yeah. Yeah, and we have now, the Autism State Plan will create a, first of all, we have a lot of parents on the board, and I am one of them, by the way. But then also Anthony Ianni also is on, who's also has an autism spectrum disorder himself. And so I think that perspective that you mentioned is represented on the board already, but then it's also, as we create the subcommittees, I think there'll be even more opportunity for inclusion, and that's critically important.
So I saw education mentioned several times, and I was wondering if there would be any attempt to, if we're talking strictly traditional public schools or helping charter schools. I know that charter schools have 2% less children with disabilities than traditional public schools. If we can incentivize them to get more autistic children or accept more autistic children.
The key in education is to make sure that that all of our education systems, particularly though our public education systems, charter and traditional public schools are all public education institutions, need to number one, be in a position to understand how to best educate and accommodate the condition of autism spectrum disorders, but then also to better coordinate or integrate with the clinical therapies. And that's part that's, it's not natural. It's not a natural process right now for a school to invite in a clinical therapist as part of an IEP team, for example. But the more that happens, the more that we change our way of thinking to be more inclusive, the more successful that our students will be, and I believe will reduce the cost. I think just as my daughter, for example, we have a goal. She's in kindergarten today, and in Portland. And so our goal is that while she does have an aide with her, and most kids like her have an aide who spend part or full time with them. You think of the cost of all the resources that are just for this one child. But our goal is for her to be completely mainstreamed with little or no support services by 3rd or 4th grade. And under the old system, she would have had that support service throughout her entire time in the education system, and maybe stayed all the way through 26. Our goals now, and yes, or even our expectations, are not only that will she be mainstreamed into the education system without an aid or the expense of an aid, but that she will graduate and then go on to other forms of education as opposed to just hanging around the K-12 system until she's 26.
I think we'll take one more question and then we'll do some one-on-one so we can get over to our next meeting. So is there a last question?
Is there a single critical goal you feel you have to meet first that will help all the rest of the goals fall into place?
Well, everybody on the council might have a different type of opinion on that. I'll give you my perspective is that that access to behavioral therapy is the critical first goal. And so without that, you're never going to be able to provide education services that help meet a child meet his or her potential. And so that's the first step, is development of that treatment network. And then beyond that, I think it's just integration of the behavioral therapy and the services together for the best possible results. These are things that shouldn't operate independently. They're things that have to happen together. Does anybody else have something to add to that?
So what the council has decided to do is, if once you are able to review the plan, you'll notice that there are a number of focus areas. So the plan is broken down into the main areas needing to be addressed. As a council, we looked at that and we're a little bit overwhelmed with, all right, each member taking over their area on their own. So we identified early identification and intervention, of which the Lieutenant Governor has begun to mention, but that includes quite a bit of work. The other priority area we have identified is adult employment and transition issues. And the reason for that is because of need, number one, but also that when we looked at what was happening around the state right now, we realized that there's actually quite a bit of momentum around that initiative and thought it was a good place to start. So especially for those interested in working with us, to know that it's not all going to be laid out immediately. We're doing this very systematically, identifying our timelines. We want to be accountable and transparent, and those are the two areas we'll start with.
All right.
Okay.
Thank you to our speakers.
Thank you, everybody.
If we can ask everyone in the next meeting at 9:30 to transition over to your next room, we're going to do some one-on-one.